Oh, finding a clinic that provides individualized care that's never rushed, but always empathetic is worth its weight in gold. That is how New Pathways Clinic wants you to feel when you meet with their team and begin your journey to mental well-being. So here to share more in this sponsored segment today, I'm happy to welcome back Executive Director and owner Steve Suntala. So good to have you back.
Thanks for having us on, Robin.
All right, let's talk about New Pathways Clinic, because I know you're looking to make an impact on, and really it is an epidemic, right, with what's going on in mental health. Mm-hmm. A lot of communities facing this, but talk about your mission really, Stephen, and your approach to care, how that differs a little bit.
So, New Pathways, we're all about the patient. We put the patient first, and we've built our whole clinic around the empathy for the patient and making sure they're personally cared for. Because one of the big problems with the mental health epidemic that we're facing is that there's not enough providers for the amount of patients that we have. There's long wait times. And even when you get care, it's oftentimes rushed and doesn't feel complete. It feels impersonal.
Yeah.
And so we really built our whole clinic to get around all of those issues. So we're trying to make a difference for people who sometimes feel discarded, not taken care of. So we really take our time to make sure that each patient has their individual mental health issues addressed in a very personal and lasting fashion.
And make sure they're heard, like you say. I mean, that's kind of the thing, right? Everybody wants to be heard in what their struggle is. That's the whole crux of it. So Steve, you want to be bold, as you say, in treating mental health issues. So talk about the ways in which you do that.
So we primarily use ketamine infusions and Spravato treatments, which is Spravato is S-ketamine, very similar, almost the same drug. So we use those treatments they're short-term treatments given over a course about a month usually. But they have a lasting impact. So this is, radically different than prescription medications, which is what, most people are familiar with when they think of mental health treatment.
Yeah.
So antidepressants, anti-anxiety medications, something that you have to take every day. There can be side effects. The relief can take 3 months to kick in. So what we're doing is more aligns with kind of like almost like a mental health surgical treatment where you're going to get immediate relief. The relief can be long-lasting. It doesn't require daily medications necessarily to get the relief to sustain.
Yeah.
So it's a radically different treatment in the mental health arena from what's already out there.
And I will say people probably have heard the term ketamine, right? And they wonder, is this like what they heard about, in the 70s? How does this differ? Tell us about the actual kind of process of the treatment, Steve.
Sure. I mean, with the ketamine treatments, what people might be familiar of it as it's used for anesthesia. They may be familiar with its use outside of a medical sense.
Sure.
But when we use it in much smaller doses than what they use in the ER or the hospital. So we do what's called sub-anesthetic doses of ketamine. So a lot of people associate ketamine where, you might be unconscious, but in this case it's a sub-anesthetic dose, given through an IV infusion or through a nasal spray, and it's under the supervision of medical care. So we have the nurses are in the room with the patients. They come in and they get an assessment. We review their mental health to make sure that they're stable, they have all their needs, they're comfortable, and then they're in a private room in a recliner. It's not really like a hospital type setting because it's not
that
really
clinical
conducive.
setting.
We try and make it as warm and comfortable for the patient so that they're relaxed and they can get the most out of the treatment. And when they're under the influence of the ketamine or the Spravato, it's a very therapeutic experience. They're going to be relaxed. They're going to have some what's called disassociation. That's the medical term for what they're experiencing. This allows them to process what's going on with their mental health or maybe address past traumas in a therapeutic manner so they feel better. But what's unique about ketamine and Spravato, there's the experience that can be psychologically important for them, but there's also the physiological effects where they just feel better afterwards.
Yeah, which they're all seeking, even if it's for a small, amount. And you're saying like this is really a successful treatment for people who struggle on the daily with a lot of common issues. So what are some of the things that you're seeing this have success with?
Depression, anxiety, PTSD, those are the 3 diagnoses that we treat, which of course are the most common mental health diagnoses seen across. So, with depression in particular is the most common diagnosis that we see. Within like our 3-week treatment plan, you can see, rapid and sometimes complete relief of symptoms.
And Steve, you
within
work
that.
with insurance in this
Yes.
manner. People often wonder that when it comes to a treatment.
We do. So yeah, we're credentialed with all major insurance companies and Medicaid and Medicare. With the ketamine infusions, there's partial coverage for the treatments. There's a portion, like the ketamine portion of it is non-covered service, but there are, the psychiatric care that we give is covered. And so there are other ketamine clinics where there's no insurance coverage. The clinics don't want to work with the insurance companies because it's difficult, but we do, for the cost benefit of the patient to pass it down. And then Spravato is fully covered by insurance for patients who are approved. As with many medical procedures, you do have to be approved by your insurance company, but if it's covered for you, it's fully covered.
Fully covered. Okay, so I want people to go to the website. You can learn more about what they do and get in contact with them. If you've been struggling, definitely worth it, to look into a new way of treatment. So, Steve, thank you for being here.
Thank you. Thanks, Ryan.